I'd like to welcome Mayor Greenberg to Family Health Centers East Broadway and the rest of you as well. Address a very important topic today, and that's Medicaid recertification, which will have a great impact upon the poor citizens of our city. So, Mayor Greenberg, you want to come up and speak?
Thank you so much, Bart, and good morning, everyone. It's great to be at Family Health Centers here. Before we get into the topic at hand, I just want to give a congratulations to and a thank you to all of the amazing team here at Family Health Centers for the work they do at this location, at their location in Portland, elsewhere around the city. And I am so thrilled that we just last week unanimously passed our fiscal year 24 budget. And that includes $2 million for the Family Health Centers to help them expand into the historic Portland Marine Hospital. And that is going to just expand the opportunities and the services that you all at Family Health Centers can continue to provide to so many members of our community that rely on you all for preventative and other medical health needs. It is critically important that we do everything we can in our community to ensure everyone has access to great medical treatment. And that's part of what we're here to talk about today, is we at Metro Government are working every day to make sure that Louisville is a safer, a stronger, and a healthier city. And today we're here to talk about being a healthier city. And part of what being healthier means is not just about being sick, but being healthy also requires that you have stable and secure housing, and that your home is free of lead or other toxins. Being healthy means that you live in a safe neighborhood with walkable streets and access to grocery stores and the ability to see a doctor when you need to see a doctor, not just when you can afford it. And during the COVID-19 public health emergency, Governor Beshear expanded eligibility for Medicaid enrollment and suspended any need for recertification. And so for context, recertification is the annual requirement that Medicaid members send in some basic household and related information to maintain their eligibility in the Medicaid program. And the state's Medicaid expansion that Governor Beshear facilitated allowed hundreds of thousands of Kentuckians to get health insurance during COVID-19 pandemic. A lot of Louisvillians took advantage of this opportunity. And because of that, our city has the lowest rate of uninsured people that we've had in a decade. That's absolutely amazing. Only 5% of Louisvillians right now are uninsured, and that's compared to 12% in 2013. As of May of this year, nearly 300,000 adults and children received Medicaid benefits in Jefferson County. Medicaid is critically important to the health of people in our community. That's almost 40% of our population here in Louisville is on Medicaid. So you can see how important this is for our entire city. So now that the federal government has declared the COVID-19 emergency over, thankfully, I'm very glad we are past that phase, the Kentucky Department for Medicaid Services has begun to recertify Medicaid eligibility for the first time in 3 years. So what that means for Louisville is that 45,000 people will need to actively recertify themselves so that they can keep their Medicaid coverage. And that includes some people who have never had to recertify because they're new to Medicaid. The good news is that recertification is pretty simple and straightforward that you'll hear more about. The Department for Medicaid Services is actively reaching out to people who need to recertify. So basically, we are encouraging people to do who are on Medicaid right now is to respond when you receive the notification from the Department for Medicaid Services that it's time to recertify your eligibility. This is not spam. This is not junk. This is real. We need people to respond so that these 45,000 families can keep their eligibility for Medicaid. We cannot afford to have our city lose 45,000 people, lose coverage because they don't know what's going on, because they miss a mail notification, or they aren't sure how to respond. We already know that people are losing access across the country, not because they're no longer eligible for Medicaid, but because they fail to act when needed. So what we're here to say today is that there's help to get through this process. If it's confusing, if you don't understand it, there are people here to help. So here to talk more about how to get help with enrollment is Priscilla Easterling, the outreach coordinator for Kentucky Voices for Health. And Dr. Bart Irwin is also going to come back up with Family Health Services to explain more about it. So first, Priscilla, if you'd like to come join us and help explain the process. Thank you very much for everything that you do.
Thank you. Hi, everyone. I'm Priscilla Easterling, the Outreach Coordinator for Kentucky Voices for Health. And, you know, there are a lot of lessons to take away from the pandemic about what works in our healthcare system, what works in our democracy and our economy. But time and time again, when America faces a crisis, Medicaid rises to the challenge and does its job. Since March 2020, states have provided continuous enrollment in Medicaid in exchange for enhanced federal funding. It's been a hugely important part of protecting families and children during the health emergency and economic uncertainty of the last 3 years. And guess what? It's really worked. Over 400,000 Kentuckians lost their jobs and their health insurance in the early months of the pandemic. And for Kentucky, Medicaid enrollment prevented a catastrophic increase in the uninsured rate during a vulnerable time for many families facing financial hardship and strain. But Medicaid doesn't only offer peace of mind and financial security for individual families, but it helped to keep providers and hospitals funded and open during the pandemic. By the end of the public health emergency, 1 in 3 Kentuckians were enrolled in Medicaid. But now as things return to normal, as they say, Medicaid renewals have begun again, and Kentucky families have to figure out what's next. Roughly 1 in 7 enrollees will need to take action to keep their coverage by responding to a notice from the Kentucky Department of Medicaid Services. Black and brown Kentuckians, families with low incomes, and those who speak English as a second language, these are the Kentuckians we need to step up and make sure that we support in particular. Kids are also especially vulnerable because of different eligibility limits for adults and kids. In fact, more kids will remain eligible for Medicaid and K-CHIP coverage, even if their parents or guardians are no longer eligible. But families with housing instability, limited English proficiency, or limited access to information may not fully understand the eligibility options available to them. The most important thing to stress right now is submit your information. Like Mayor Greenberg said, almost 300,000 Jefferson County residents still have to go through this renewal process. Even if your circumstances have changed, even if you don't think that you're still eligible, submit your information. What we've seen so far since renewal restarted in May, is that almost half the people who lost their Medicaid coverage didn't lose it because they were ruled ineligible. They lost it because they simply didn't respond. So make sure that you respond promptly to any requests for information and let the Department of Medicaid Services decide whether or not you're eligible. They're the eligibility experts. Income limits have changed since 2020, so things could look differently for your family now. Give DMS the updated information that they need to make a decision. Don't make it for them. It's important to remember that this is a return to normal. These are just standard processes, and it's just that because of the pandemic, many folks have never had to go through them. Kentuckians need to know now that if they didn't respond, it's not too late. You have 90 days after your renewal date to submit your documentation to DMS. If DMS determines that you're still eligible, you can re-enroll with your coverage backdated to cover any gaps. If you're ruled ineligible, you have the right to appeal and reapply. But a key thing to remember is that thankfully, connectors are always available to help explain and walk people through this whole process. To talk more about how connectors can help, here is the CEO of Family Health Centers, Dr. Bart Irwin.
Thanks, Priscilla, and thanks to Kentucky Voices for Health for their continued advocacy for citizens in Kentucky and Jefferson County. So I'm the nuts and bolts guy. What do? There are 3 things that are important to remember. 1, update your information with the Department for Medicaid Services. 2, respond immediately to any letters you receive from the Department of Medicaid Services. And 3, get help if needed. Updating the information. Medicaid services will require an updated phone number, street address, and email address, and any other contact information so that they can get a hold of Medicaid recipients in regard to recertification. The number that you can call for assistance from DMS is on your left, the far board on your left. Second, respond to information requests that the Department of Medicaid Services sends. When you receive a notice about Medicaid recertification, you have 30 days to respond. Don't delay. Take action right away. The Department for Medicaid Services may ask you to provide some additional information, such as proof of income. And this would meet the criteria if you send 2 months of paycheck stubs, an employer statement as to your income, tax return, supplemental security income statement or SSI, or if you have no income, you may send a letter from a non-household member who knows your situation. They may also ask proof that you live in Kentucky. This can be proved by a state-issued ID, utility bill addressed to you, or other document addressed to you with your name and current address. There are several ways to send this information to DMS. That is, you can mail the information, you can upload the information using the Connect website, and if you are having trouble, certainly reach out to Medicaid Services. They can assist you in getting that information to them. Because Medicaid recertification will take place over a period of 12 months, recipients may not get a letter right away. It may be 6 months, it may be 10 months. And if recipients want to know when they can expect their letter, they can contact the connectky.gov, that's connectky.gov, and ask when they might be expected to receive that information from DMS. Third point, if you need it, get help and assistance with recertifying. You can contact a connector who has been specially trained to assist you. Connectors may be contacted by using internet to connect with get-covered-lu. I believe that's to your right on the board. And they can help put in contact with connectors. Places in Jefferson County that provide connectors are family health centers, KIPTA, Park Duval, and neighborhood places. That's where you can physically walk into and request assistance at those places as well. So, 3 things. Update your information with the Department of Medicaid Services, immediately respond to any letters that you receive from them, and get help if needed. Mayor Greenberg, I'll turn it back over to you.
Thank you all so much. Having great partners like this is critically important. So I just want to say thanks to all of our partners, Kentucky Voices for Health, Family Health Centers, KIPTA, which is Kentuckiana Regional Planning and Development Agency, and Park Duval Community Health Center, and all of the members of the media who are here with us today to help us share this message. We want to help as many people as possible throughout Louisville keep their health care coverage. This is critically important. Let's turn this situation that's new for some people, going back to normal pre-COVID days for others. But we need to keep our rates of insured individuals in Louisville up and our uninsured rates low. As you heard earlier, we are right now at record low uninsured health rates in our city. That is wonderful, and we want to keep it. So please, for more information on Medicaid renewal at Get Covered Lou on our Metro website, which is louisvilleky.gov, contact one of these organizations, follow the steps that Dr. Irwin said, and please, I appreciate the media being with us here today so that people who are in need can truly understand this information so that they can keep their coverage and remain covered by Medicaid. Thank you all very much, and we are happy to take any questions that you all might have.
Just a quick point of clarification. The mayor said, I think it was 45,000 people in Louisville, and I think Priscilla said 300,000 in Jefferson.
300,000 people is the total number of people in Jefferson County that receive Medicaid benefits, and 40,000, I believe, is the number who need to recertify. Is that right?
Yes.
Yeah.
It's about 1 in 7 as they are going through the system though and doing the process. Some more folks are going to have to take action than they initially expected as they're sorting through updated information. So it is roughly around 45,000, but it could be a little bit more.
Yes.
Another quick point of clarification. I believe someone said a 90-day timeline, and another person said 30 days after getting that notification. Can you just clarify some of the timelines? Make sure.
Priscilla, you can correct me if I'm incorrect here. Once you receive a letter from DMS, you have 30 days to respond. Now, you may have 90 days to provide the information requested.
And not every, oh, go ahead.
Oh, yeah, so the notices are going out about 45 days before the deadline to submit information. But even if you miss that deadline, you have 90 days after the deadline to submit that information and get re-enrolled in that plan, as long as you're determined eligible.
It's the federal government. Why would it be simple, right? That's why we're trying to make it as simple as possible so people just know to respond. And not everyone is getting it on the same date, correct? So that's the other challenge here. Is it's not like everyone gets the notice. It's not like there's a one specific due date like the tax deadline. Different people will get these notifications at different times. So we need to start getting the word out now so people know this as they receive this in the mail.
We're 1 month into a 12-month process. So a lot of more people are going to get notices over the next 11 months. And it's so important that everyone responds. Just open the mail. Commonwealth of Kentucky, open it and check it, and you'll know what to do. And if you're not sure, connectors are available.
Well said. All right, well, thank you all very much. Have a wonderful day.
Thank you.